Every food service and retail food business is required to have a designated person in charge who is responsible for the operation and must be present during all hours of operation. As the person in charge, you are the first line of defense against foodborne illnesses being spread in food service settings. In the U.S., 48 million people get sick from foodborne illnesses each year. Young children, the elderly, and those with a weak immune system are especially vulnerable. As the person in charge of a food service and retail operation, the state food code requires you to know about health and safety hazards, educate your employees, and report to the health department. The person in charge must be able to demonstrate their ability to recognize health hazards in food products, employee practices, and during an event or emergency that requires immediate correction to prevent illness or injury. The person in charge must be prepared to manage any circumstance on the premise that may endanger public health, such as fire, flood, interruption of electrical or water service, sewage backup, misuse of toxic chemicals, or reports of apparent foodborne illness. The person in charge must know when to report the situation and corrective actions to the health department. You may need permission to resume operation depending on the health hazard and level of risk to public health. The remainder of this session will focus on the person in charge's responsibility in knowing how to prevent foodborne illnesses that can be spread through food to customers, educating their employees, and reporting any situations. The 5 most common contributing risk factors that cause outbreaks of foodborne illness in retail food service are purchasing food from unsafe sources, failing to cook food adequately, holding food at incorrect temperatures, using contaminated equipment, practicing poor personal hygiene. This session focuses on risk factor number 5, practicing poor personal hygiene, and stresses the importance of training and having an employee health policy. Here's why. Food can become contaminated when handled by an ill employee. This is the most common cause of foodborne illness outbreaks occurring in retail food service. The person in charge must ensure that essential training is provided to educate all employees of the proper food safety regulations. The person in charge must ensure that essential training is provided to all employees, including how and when to wash hands correctly, how to prevent bare hand contact with ready-to-eat foods by using gloves or utensils, food safety, food allergy awareness, food defense from intentional contamination, preventative controls, corrective actions, the responsibility to report illnesses to the person in charge, and that unnecessary people are not allowed in food preparation, storage, or cleaning areas. Any food handler with symptoms of vomiting, diarrhea, and jaundice should be excluded from working directly with food. A food handler reporting vomiting, diarrhea, or jaundice must be excluded for at least 24 hours after symptoms go away. The only exception is when an employee has a note from the doctor stating that the symptoms are a result of a health condition that is not infectious. When a food handler reports a sore throat with fever, and in some cases when an infected wound is reported but adequately covered, the person in charge may determine the employee is okay to return to work, but should be restricted to non-food contact activities until they are healthy. The Big 6 reportable foodborne illnesses are highly contagious and can be transmitted by food handlers practicing poor personal hygiene. It is very important that the person in charge and employees recognize the symptoms of these foodborne illnesses and know their responsibilities in reporting. The person in charge must provide training and education to all employees regarding foodborne illness symptoms and the Big 6 reportable foodborne illnesses. Employees are required to notify the person in charge if they are diagnosed with or exposed to any of the Big 6 or are experiencing any of the symptoms of vomiting, diarrhea, or jaundice. Training on employee health should be documented by the person in charge, for example, by a signed employee reporting agreement, curriculum and attendance rosters, or a written employee health policy, etc. If any food handler is told by a doctor that they have any of the Big 6 reportable foodborne illnesses, they must report the diagnosis to the person in charge. The person in charge must report the diagnosis to the health department. In most cases, the health department is required to pre-approve an employee diagnosed with the Big 6 to return to work. Prevent the spread of foodborne illness and keep your customers and business healthy by knowing, educating, and reporting the Big 6 and the symptoms.